As the cases of coronavirus continue to rise in Nigeria, it's extremely vital to know those are the greatest risk. People with underlying health conditions are more likely to experience worse symptoms or develop complications if they contract the virus. We'll take a look at some of these underlying health conditions and how risky it is for those who have them.
There are hundreds of health conditions which may affect immune function, such as heart disease, chronic respiratory disease, diabetes, cancer, and high blood pressure, which are the reasons for the highest number of fatalities from this pandemic.
How we can use what we have.
Patrick Dakum is the CEO of the Institute for Human Virology in Nigeria. He explains to us via a Skype-recorded interview how these underlying health conditions can be a problem for the aged or those with other medical conditions.
First of all, I think anybody above 60 is at risk. 2, anybody that has an underlying disease, you need, in fact, to avoid interacting with people as at now, because these are indicators that put you at a higher risk of dying.
Nigeria has more than 20 million people with high blood pressure, 3.9 million with diabetes, and cancer deaths are at more than 40,000. Nigeria also accounts for about 1.9 million people living with HIV and AIDS, and this coronavirus is a scary development for persons living with the disease.
They were showing how
the Director General of the National Agency for the Control of AIDS says the concern is for those living with HIV and AIDS to stay safe and also to ensure that they can get access to treatment even at a time of the lockdown by the government.
We know HIV by nature fights the body defense system, and it makes the body defense system weak and eventually destroys the body defense system, making individuals or their victims vulnerable to all sorts of diseases and illnesses.
He emphasizes the need for all facilities to ensure that they all have enough stock of antiretroviral drugs for persons living with the disease and for their treatment patterns.
If they have drugs with them, they should check those drugs and make sure that they have a refill that will last for a minimum of 1 month. Otherwise, they should get out and go to those facilities. And it's not going to be difficult in the sense that they have every right to go to the hospital because the hospital people are there working.
Having an underlying medical condition is not a death sentence, but the advice still remains to maintain all precautions highlighted by experts in order to stay safe. Kemi Balogun, TVC News, Abuja.